Hi, this is Corey McCray, the Senator for the 45th Legislative District, and you're listening to the Conduit Street Podcast, my go-to source for the latest news and insight on state and local government in Maryland.
Hello and welcome to the Conduit Street Podcast. Kevin Kinnally back in the saddle with Michael Sanderson, and we have Dominic Butchko with us as well. Michael, how are you? How are things holding up? I know you had a lot of FOMO last week. Dom held it down with the rest of the policy team. You and I were not on the episode, but I know that you sent a tweet out. You were telling me that you were nervous. You wanted to be on the episode. You just had that FOMO, I guess.
Well, it was a good change of pace. Actually, I thought our colleagues did a nice job running down a number of different things as sort of a session wrap up. But it was weird. I was pacing the floors a little bit. I was nervous about. We've cared for and loved this little podcast creation. Over the last several years. So suddenly having an episode with no Kevin and no Michael, it felt foreign. It felt weird and difficult. But I kind of got over it. I'm feeling good about it now. I want more of that, actually.
Yeah, they did a great job. Dom, you did a fantastic job. And Dom, welcome back this week. But before we get to you, Dom, Michael, it is 420. And whatever you think about that, I'm sure you have a dad joke for us to reference 420 as we sit here on Thursday and record this podcast.
So we're recording on 420. We're supposed to. All right, I got one for you guys.
I know you have one. Come
on. What do you call a housefly that smokes pot, or maybe smokes like adult use legalized cannabis for those of us who are following Maryland politics? But what do you call a housefly who engages?
Dom, you got anything?
I have no idea.
A high flyer.
Wow. Yep, that's about right. That's about right. So dad joke out of the way on 420. Let's get into our content. And we do have Dom with us. Dom covers, among many other things, public safety issues, firefighting, particularly for MACO. And that's what we're going to talk about today. We're going to talk about the future of public safety in Maryland and why MACO is trying to stay ahead of the curve to ensure that firefighters, EMS, police, 911 specialists, all of our public safety folks have what they need to do their jobs. And what we're talking about here is making sure that our first responders have the latest technology, and that's important to decrease response times, keep them connected with one another, provide real-time analytics, ultimately save lives. That's the goal here, and that's what we want to get into today and talk about MACO's advocacy and what county leaders are telling us is important to them as we move forward with public safety.
I think that's the key, Kevin. That's why I felt like, when we were talking about this conversation for an episode of the podcast, I feel like the theme here is, we're a member-driven organization. MACO, the county governments are our members, and we know that the leaders in county governments are elected. They change over time, but sort of the mission of what you do in local government, it changes more slowly. There are some core principles of what you owe to your residents, to your taxpayers, and your neighbors as part of local government service. And I feel like that mission kind of permeates our organization in a really healthy way. We have a tendency to play a lot of reaction during the legislative session. We spend our time on this podcast talking about we took a position on this bill that came from here. We took a position on that bill that came from there. But our annual process of taking up our own top priorities, our own legislative initiatives, that's really a bottom-up process. It's our own members suggest, I want MACO to tackle this. I want MACO to get involved in this. We ought to move the needle on that. And over the last several years, there's a connecting theme that public safety is changing. We need to do right in this area with better service, better technology, better ways to respond. And we can't do this all by ourselves. We need state partners to bring these things along statewide, change the laws, do some updates. And we're going to stitch together a few things in this episode that are all on that theme. But I think it's MACO recognizing our members are asking for this, and that's why we exist, is to help them do better for their residents.
Absolutely. And Dom, you're relatively new to MACO, a few sessions under your belt, but you have a lot of experience in local government before this. And I'm sure when you got here, we were right in the midst of what Michael's talking about, this multi-year effort to address multiple things in public safety. And that must have been, pretty eye-opening for you to step in and realize that, hey, this is at the forefront, not just 911, not just police, not just EMS, firefighters, the whole gambit. And that was sort of dropped into your lap. And I know you were on talking about some of that last week, but that had to be pretty eye-opening for you to come in and realize that, hey, this is what we're hearing from our counties, and we're going to have to do a lot of work here.
Yeah. So, I mean, everyone knows that I am from Pennsylvania, and in my former life, I was an elected official up there. I think the thing that surprised me the most was the issues that we had in my jurisdiction back home, and the issues we're having in Maryland are pretty universal. Everyone is having a hard time recruiting firefighters, and in certain areas, police officers. Everyone wants to provide those necessary public services to our most vulnerable in need. And so the synergies there are the same, the problems are the same. And it's really nice to work for an organization where we can be part of the solution and not just, we're going to cut a bigger check, but how can we rework the policies? How can we get better technology? How can we use the systems we have and reformat them for the 21st century? I mean, that's very exciting and fulfilling.
I agree. And if it's okay with both of you, I think we can start with next generation 911. And that was really, I think, the first big public safety issue, at least in the past few years, and stitching this together that we were engaged in. And I can take the lead on this if that's all right. I've worked really closely with our 911 folks over, again, the years and years now. And what we first heard from our local elected officials was that we have this thing coming called Next Gen 911. And this must have been back in 2016 or something. And we were hearing that counties really wanted to do this, and they needed to make sure that they had this technology, but that they were having trouble funding just the current 911, like your standard 911 center, the fees that are used to fund 911, they weren't covering only that, right? So how could we move to Next Gen 911 if we don't have a fee structure that can actually cover the costs? And then it was also daunting to think about, how can we do this statewide? The public safety, old school public safety, often you have people operating in silos and people weren't really talking to each other. Mm-hmm. And so we had to lift the roofs off of those silos and make sure that everybody was interconnected. And that's the whole idea behind Next Gen 911, the new technology, again, reducing response times, keeping first responders connected, making sure that we can identify where someone is calling or texting from. Because we have technology to do that. Before, we were just relying on, the closest cell phone tower to kind of estimate where somebody was. But if they couldn't tell you, you really didn't know. And of course, that creates a problem for people trying to respond to emergencies. So it was a daunting effort. And I think we realized early on that we couldn't do this alone. Not just a few counties, not every county. We needed state partners. We needed the private sector to weigh in and buy into this. And so we realized that we needed to stand up a commission. And this was, oftentimes you hear things referred to as like a blue ribbon commission. This really was that. I mean, if you think about the folks that we had on that commission, from county public safety, county elected officials, county finance people, you had the state police, you had state representatives, you had people from the private sector, you had 911 professionals that were coming in and consulting from across the country. And this commission operated for multiple years, and we passed multiple bills to provide the resources we need for Next Gen 911, to make sure that we're accountable with the funding, to make sure that we continue to utilize and use an all boats rise approach across the state, right? So we want to make sure that the service that's available all the way out in Garrett County is also available in Worcester County. So wherever you go in Maryland, we want to make sure that you have the same capabilities to reach out to 911 when you need help. And we're well on our way. We fixed the fee structure. We've made sure that we've, again, eliminated those silos. Everyone's on the same page, and we're really adopting a statewide approach here in Maryland to doing that. And there's no doubt that's going to save lives. And the technology that we can use with Next Gen 911 is really mind-blowing. We've been showcasing it at Mako conferences. I think we're going to do it again at our upcoming summer conference in August. And if you haven't had a chance to go and sit in and see that technology in action, it is amazing. It's a wonderful investment, and we're going to save lives. But I think the focus should be here, how we got there. This was a problem. Nobody wanted to take a swing at this because nobody knew how to do it. It was such a daunting effort. And the only way was to get all the right people in the room and to figure this out and to painstakingly go through each part of this and get buy-in was the right way to do it. And I think that's the right approach. And I think that sort of kickstarted, like you mentioned, Michael, this we're stitching together multiple issues here. I think that really kickstarted the efforts in terms of our focus on public safety over the past few years. And I'm super, super proud of it. We need to give a shout out to Senator Cheryl Kagan, who has led this effort and partnered with Mako to pass, again, these multiple bills that move Maryland forward and are going to save lives. So big shout out to Senator Kagan, big shout out to the Next Gen 911 Commission. Incredibly proud of the work. The work will continue, but we're well on our way. We're leading the country now in terms of our preparedness and what we're doing to make sure that we can implement a statewide 911 system that has that next generation capability and technology and will keep Marylanders safe and save lives. So I'm incredibly proud of it.
Right. And I mean, so it's a monumental effort. The successes we achieved in Maryland simply don't happen without Senator Kagan and a number of her colleagues in the legislature, a number of people who worked really hard on this process. But to dial back just a couple of clicks, why did we need to reinvent 911 policy in Maryland and most everywhere? It's because look how much the game has changed just in the time that this notion of a universal call number has existed since, I guess, probably the 70s. I mean, if we've got 50 or so years of experience with this as a concept, that originally telephone service was a regulated monopoly utility. You had one local telephone company. So the idea of the government saying, well, we'll just make the telephone company tell us where the call is coming from, direct all these, 3-digit numbers to a certain place. And it was a sort of one-to-one relationship between the government says this and the regulated telephone company does that. I mean, telephone service has enormously changed in these last 50 years. It was the 1990s. Maryland said, okay, we need to rethink all this stuff. There still are local carriers, but long distance is different and people are starting to use wireless telephones and cell phones and other things like that. So these different devices are accessing 911. We got to change the laws on that front. We needed a wholesale relook at this. And that question of being able to locate where the caller is was the easiest piece to understand. There were other technical parts of next generation 911 that you can speak to more clearly than I can. But at its core, we were just sort of like doing our best to triangulate based on the nearest few cell towers, right? If you were in sort of a rural area by the side of the road and you're calling to say my car's in a ditch and one of my passengers is hurt, well, what road are you on? What's the nearest cross street? What's the nearest mile marker? I don't know any of that. And we'd have to go based on, okay, the signal seems strongest from this pole and weaker from that pole. So they're probably within a quarter mile of this spot. Like, that's not the best way to get people immediate help. Next generation 911 was about harnessing stronger and smarter technologies so that mobile callers, where now the overwhelming majority of emergency calls come from mobile phones. Let's find out where those people are and get them help quickly. People want that. They expect it. They deserve it. And for us to get there across the state, not just based on who's got the resources, that's a really important policy advance. So I'm with you on spiking the football and feeling like we did right here. It took a few years to go through all that process, but it was totally worth it.
No doubt. And, the first 911 call, I shouldn't know this, but I now am a 911 nerd, was made in 1968 in Alabama. So yes, Michael, right near the 70s, you're right. And yeah, we've evolved a lot since then. The technology that's out there is unbelievable. So yeah, location accuracy, also providing first responders. You talk about stuff like GIS, geographical information systems. When a firefighter shows up to a big apartment building, they can have a map right in front of them to show them exactly what the floor plan is, where they need to go in, where potential hazards are. Like, this stuff is about keeping the public safe, also our first responders, and getting them the information quickly that they need to do their jobs. And so, yeah, it's an incredible effort. 911 has existed for a long time. They were kind of shoved into a corner, I feel like, here in Maryland, and no one really paid attention, but we really elevated them to the role of what they actually are, which is the first responder. And, we've also done a lot of work in making sure that we're recognizing their work and bringing them into the fold and making sure that people know they are first responders. So I'm proud of that as well, because the work that they do is incredibly important. So big effort, happy about it. Shout out to the General Assembly, Senator Kagan and her colleagues that served on the commission, but a multi-year effort that will continue, and super, super proud of it. And I think from there, establishing that commission and making sure that we did it the right way, I think we learned a lot as well. And I think that we learned a lot of different perspectives from within the public safety community. And I want to get into sort of the next theme here, which is EMS. And as we go from 911 to EMS, Dom, that was something you really worked on, and I want to get into that as well.
Yeah. So Kevin, before we transition to that, though, I still want to talk about this 911 because I think there's something really interesting, like from a 3,000-foot view here. The idea of we have people in our communities who are in need. We have services that they need, whether they be emergency services or social services, et cetera. Many people might not know this, but I'm actually on the board of 211 Maryland. And so that is a 3-digit number that you can call, or you can go on their website, the Maryland Information Network, and you can get help for housing, for food assistance, for children and families. I mean, the list is really endless. But the idea that we can have these easy 3-digit numbers for when people in our community are having real emergencies, and not every emergency is a 911 emergency, but that they can go out and get those social services. I mean, it's government for the 21st century. I think that's awesome. So I got to applaud you for that work. And I think that concept is something that we should emulate, going further. But to transition now too, to talk on EMS, another thing that we brought into the 21st century here at Mako. I mean, EMS is a major issue. When you call 911, you have a certain expectation of service, but things have changed and we needed to update and modernize those systems. And, what we use medical care for, the last time a lot of our EMS laws were put into place, 1999, things have changed significantly. And so I know in our last initiative, we updated a lot of that. I think, Michael, you have some thoughts on that.
Just like when we talk about an issue being a Mako initiative, there's a little process behind that may not be obvious, but it kind of makes sense. I sort of made mention up at the front of this pod that we go through a process every year with our members and with our own leadership of the association to take on a limited number of topics as the things we want to advance ourselves. So we respond to lots of things, but we always start each legislative session with sort of a one-pager of here are a few top issues where we're asking for help from legislative leaders, from policymakers at the state level, where we need your help to do something. And this is one of those topics that sort of in the wake of making great strides on 911, we were like, emergency services is one of those areas. And in particular, we're talking about under what conditions is an ambulance response to an emergency call actually effectively healthcare for purposes of your health insurance, for Medicaid or Medicare or private health insurance. And those are the laws that you had said it's been since 1999 since that stuff was really topped off. Definitely due for a change. Same theory. Things have changed in the last 20 some years, and we needed the state laws to better reflect what's really happening on the ground. So our folks said, go get it. And that's why we went to work back in the 22 session to pull some stuff together on it.
Yeah. And so just to highlight too, I want to recap some of the awesome stuff we did, because we really did take a system and really changed it for the 21st century without really adjusting that much. So first, MIH, Mobile Integrated Health. I know that is a term that longtime listeners are very familiar with. And that is, we're going to go and we're going to treat in the field. We're going to do preventative care. We have these ambulances, we have these equipment and everything else. Let's use them to their fullest and not just only have a responsive and a reactive system, but let's have a proactive system and try to, do preventative care, do preventative medicine. We were also able to get our reimbursement change. We got a 50% increase. So it went from $100 to $150. And again, last time it was changed was in 1999. So a lot has changed between 1999 and 2022. A lot has changed between 2022 and 2023. So we were also able to get to just the universe of things that you can now use an ambulance for reimbursed. So traditionally, you call 911, the ambulance shows up and takes you to a hospital or an ER. That was the only thing that our EMS folks were getting reimbursed for. So any treatment they did in the field, any treatment they did on the way, there was no reimbursement for that whatsoever. And so we're not incentivizing our folks to go out and do the work that you need to do. Now you have an additional incentive. And, we don't want to only talk about money, but government is funded with certain resources, and we need those resources to provide certain levels of care. Also, the ER is not always the most appropriate place to take someone. So let's say that there's a mental health facility. Let's say that an urgent care. Let's say treatment in the field is most appropriate. Now all of that is accepted under the reforms that we got.
Right. I think, well, like you said, this is a matter of it's time for Maryland state law to recognize that healthcare happens in a lot of different settings, not simply in the building with the big blue H on it, right? So, I mean, the easiest to understand example might be the opioid crisis that has been sweeping the country and challenging communities everywhere, including every corner of Maryland. We've had an alarming number of our residents and neighbors call 911 because they or a family member or a friend is in distress with an opioid overdose, right? Someone took a pill and it's got something wrong in it or whatnot. People who are in active overdose for opioids can get immediate treatment from the person who, under Maryland law until last year, was basically just a driver. Like, that's all we recognize ambulances are, as we drive people to the hospital for care. And the idea of the EMT hops out of the ambulance, recognizes someone's in active overdose, administers a medication like Narcan, and solves the problem in 10 minutes. That's the right way to deal with this health crisis. And our laws from 1999 just weren't reflecting, nothing happened because no one got a hospital ride. Okay, it was time to make smarter laws because things have changed on the ground. And so that's healthcare. When you stabilize somebody who is in sugar shock, they have a blood sugar crisis, you might administer what they need right in their home. They may not need a trip to the hospital, but that was healthcare delivered on site. And your insurance company should recognize that and reimburse the cost. We're not talking about sending people a bill. We're talking about insurance companies, including government insurance, recognizing that that's healthcare too. It's just more modern, smart policy.
And, Michael, to expand on that too, I think everything you just said was brilliant and 100% correct. Like, let's think of the modern health crises we just went through. You mentioned opioids, you mentioned COVID. So we have a virus right now that we're still battling, although to a lesser extent, that when you have groups of people coagulated together, that virus is going to spread. So if you have something that you can treat in the field very easily, do you really want to take them to an ER or to a hospital that's already overburdened? I mean, this has so many domino and tangential impacts that this one policy change, it's just a smarter way to deliver a service that we've been delivering for decades now.
Yeah, and the way I look at this is meeting people where they are. That's a big part of this. And Dom, you mentioned mobile integrated health. That's exactly what that's all about. So Dom, a lot of work has been done here, but there's still a lot of work left to do when it comes to making sure that EMS is properly funded and that we are doing it in a smart way that's modern.
Yeah, so the way that this issue ended was we got a reimbursement and we got the expansion of things that we can do through fiscal year 2025. There's a study going on right now with all of the stakeholders. Mako is certainly at the table with what's the best way to fund this and kind of shape this for the 21st century. So during our next legislative session is when we should see that study and then really start to have those conversations. We realized there was an issue. This bill passed during the ending part of COVID. But we know, we want to fix it for the future. What's the best way? We put a Band-Aid, now we want to do a permanent fix. And so I'm really excited to see what that study says and then to get in those conversations for next year.
And let's move in now, Dom, to an initiative from this legislative session, our 2023 session. This is an initiative on firefighters, not just volunteer and career. This is an issue that's super important. Why did our members really want to lead into this one, Dom? You took the lead here. I know you've done a lot of work. Why did this bubble up to being one of Mako's top 4 initiatives for the 2023 session?
Yeah, so firefighter recruitment and retention is huge. And on its face, it appears to be just, a rural Eastern Shore, Western Maryland issue. But when you really dig in, this impacts all of our members, especially in some of our largest jurisdictions. And so I want to break this conversation down into 2 buckets. So firefighting right now, you either have a career structure where, the county or the municipality in some cases has a paid fire department. Or you have a volunteer structure where, exactly as it sounds, you have volunteer firehouses. People sign up in the community. They say they want to join, and then they sign so many hours. Hopefully, they're there when you call 911. Historically, we've seen firefighting as a volunteer. So the career in the history of all of this is relatively newer. Where there's stories back, I think Benjamin Franklin founded the first volunteer fire company in the 17 somethings. So, but we're seeing for the first time really a recruitment and retention crisis in both. And I think crisis is an appropriate word for this. So on the career end, traditionally we would have, let's say for the fire academy, 50 seats. We would usually get 1,000 applications for 50 seats. And we would very easily be able to comb through all of those applications and, find 50 good people. Now we're seeing somewhere between 200 and 250 applications. And so you may be saying to yourself, 200 and 250 for 50 seats, that still doesn't seem that bad. Well, actually it is. The standards that we have for our firefighters have gone up, and rightly so. The world has changed. We have better equipment and we expect more of our public servants. But the standards have gotten tougher and the pool of applicants have gotten lower. And just like the military, people say they want to do this. They get excited about the adrenaline. They go to basic training and oops, it turns out I'm not that qualified for this role, or I can't do this, or I don't have the skill set that I thought I did. And so we're having difficulty now on the career side, putting in, 50 people to actually just go through the whole class. Then on top of that, now let's say we have 35, we don't even meet the 50. Everyone is bidding for those 35. Everyone wants them. And so it becomes difficult to really fill that.
Yeah, and that's a big deal for the career side. And Dom, when you get into volunteer, that's a whole nother bag. And I think same along the lines of 911 operating in silos in the past, you have this tension between volunteer and career fire service. And that's not just in Maryland, that seems to be everywhere. And I think a big reason why we wanted to make sure this was career and volunteer was, again, taking that whole approach into making sure that we're not just focusing on one segment, but we're really trying to bring in all firefighters, because again, they all share the common goal. It's just a little bit different in terms of how they get there. So the recruitment for career firefighters, certainly that's a problem. Retaining them is a problem. But talk a little bit about some of the challenges when it comes to volunteer firefighters in Maryland.
Yeah, so volunteer is particularly interesting because career, let's say, the incentive is I'm going to get a paycheck. I'm going to do this for my living. Volunteer is an entirely different demographic. Volunteer is much more cultural. Volunteer firehouses used to be, a core part of the community. You went to the fire hall, you belonged. That's where you met your friends. Your family was there for generations. Maybe that's where you met your wife because she was related to someone. Because back in the day, it was not a gender inclusive industry. So, but volunteer used to be the core of communities. We're seeing a lot of social change. We're seeing it in our politics. We're seeing it, and we were talking about service delivery with the 21st century. We're recording this on Zoom right now. The world is changing. That connective tissue that we used to have as a community is really now starting to dissolve, and it's impacting one of our key public services, which is the fire service. A lot of our communities depend on volunteer firefighting services. I know two of our counties, Baltimore County and Prince George's County, have both career and volunteer firefighting services. So making sure that they have enough people engaged in both is important. And volunteers in those jurisdictions that don't have a lot of volunteers, you still have mutual aid. So, there's a mutual aid network across the entire U.S. where basically, we have a huge fire. I think one happened actually the other day in Baltimore County, where you have a huge fire. You're going to send your main units, and then you have certain auxiliary ones. Maybe they're volunteer, maybe they're other career. But when you're taking out, it's like a Jenga tower, key pieces of that network, the whole thing becomes unstable. And I think a really interesting kind of dichotomy of where we're at right now, I was reading a book the other day about Tammany Hall, and they were talking about the first volunteer fire companies in New York City, where two of them would show up to a fire and they would actually fight each other instead of putting out the fire, but they were all really engaged. They were all there. You had multiple volunteer fire companies showing up. Well, now we're in a situation where our recruitment and retention numbers on the volunteer side are so low, Today we're fine where people will show up, but we're worried, a couple decades from now, are we going to have anyone? And so within the past, let's say 250 years, that multiple fire companies to potentially zero, that says a lot about how we've transitioned.
I think like that lays the groundwork for why we needed to come to Annapolis and ask for help from state policymakers. That this challenge is broad, it's deep. There are sociological elements behind it. There are financial elements behind it. The higher level of training and the expectation for people who want to serve in either a volunteer or in a career capacity, like all of this stuff is challenging and difficult. So it lends itself to the same kind of approach that we took with Next Gen 911. We can't do this ourselves. Calvert County and Cecil County and Worcester County independently don't have the wherewithal to just thread this needle and figure it all out. It's probably going to take a number of stakeholders, including leadership in the current service, both career and volunteers today, as well as the county governments who support them and other players who are in and around this whole field of service. Like, we need to get all the stakeholders together. So, that's why this year's bill was, rather than here's a bill that we think is the solution, let's do A, B, C, and D, rather this year's bill was, we want the General Assembly to bless a formal work group to come together and focus on this, like bring together a commission, get the right people in the room, and try and build that consensus so that policymakers get a sense that there's buy-in from everybody along the spectrum, right? So that's the gist of MACO's effort this year that was successful.
Yeah, I don't think we can underline enough how much this bill was an all hands on deck, all stakeholders. We literally had everyone from you're in the fire academy to you are retiring and to everything in between. We had labor, we had leadership and management, we had the MSFA, the PFFM, we had MML, we had MACO, we had all of the other, letters in the alphabet soup. Everyone is here working on this initiative with us. And it's important we get this right.
Yeah, and we've said this before, but legislators really like it when you bring them a final product that everybody has signed off on. So when you do the legwork, when you do the work up front to make sure that you have all the right people in the room and everybody can agree, you can bring a finished product that everybody feels comfortable with, and that they don't have to reach out to, like the alphabet soup Don just mentioned, to make sure that everybody's okay. You bring them a report that has recommendations, and they really like that because you're doing the work ahead of time, and that's a really good thing that leads to good outcomes. So I agree there, Dom. So we've gotten into 911, EMS, firefighting. Where are the other areas where we still need to take steps to catch up with modern times? And I'll throw that one to you, Michael. What do you see in the future here?
Right. So I think that's like an interesting way to tie this together. If we feel like all three of these areas are things have changed, it's time for state law and public policy to catch up with the changing times, then I think maybe, we've been thinking about sort of emergency response as an important part of public safety and how different it is today than 15 or 55 years ago, right? So, let's take a look at actual law enforcement, like officers on the beat and on patrol and preventing and solving crimes and so forth. Like we know the obvious thing coming with technology is, in the space of the next couple of years, every single county law enforcement officer or sheriff's deputy needs to be equipped with a body-worn camera. And the camera should be on in most interactions with people and most, situations where you're, engaging and so forth. So that's a pretty big change in technology where we've been working for some time. We've talked on the podcast before about trying to get that technology right. We got some important legislation this year to try and make the buying of the equipment and the systems smarter and smoother. So that's a good outcome. But I still feel like there's a frontier here of what do you do with all that footage? We haven't threaded that needle yet. We haven't yet found the consensus on how you should change state laws to deal with, like, we want sunshine laws. We want the Public Information Act to say that people are entitled to see documents that are being held by public custodians. Generally speaking, yes, but there are exceptions to those rules. And where do you create smart exceptions so you don't expose victims and children and other sensitive stuff that just is going to get picked up in the background of body-worn camera footage? That's a real issue. We've still got some time before that's a statewide mandate, but I think that's an obvious one that's sitting out there, not directly connected to what we were getting into today, but I think it's the obvious low-hanging fruit for us to continue to focus on.
Yeah, and the controversial issues there. And again, it's about getting that buy-in. And I know we've been doing a lot of the work and with other stakeholders to try and make sure that everybody's comfortable and that we are crafting good policy that can balance those interests, as you mentioned. And then, Dom, we mentioned 3-digit numbers earlier. I think there's a little bit more to talk about there as well as we continue to move forward in our capabilities and what we can provide for our residents.
100%. So, we talked about 911, we talked about 211, 311 is the non-emergency call number that some counties have already implemented and might be on the horizon statewide. That's the number where if you have a pothole or something, you call and you let your jurisdiction know. But I think that there's a broader conversation here about how can we make our public services more accessible and better. I mean, we were talking before we were recording, Michael was saying he used to have a 7-digit phone number, taped to his phone for the firehouse. Now we're down to a 3-digit number. And now we're transitioning to a future where we're not even going to have a phone number. It's all going to be web-based. There's going to be apps. And so I think the future there is really exciting. Like I said, I'm on the board of 211, the stuff that we're looking at to really get these badly needed services to our most vulnerable. Those new pipelines are very exciting. And I think there's a lot of work in this area ahead.
No doubt about it. And it's going to keep all of us gainfully employed as we continue to try and crack this nut for some of these complicated public safety issues. Any closing thoughts, gentlemen, before we wrap this up today? I think this is a good rundown of sort of our approach to addressing these complex issues and getting that stakeholder buy-in, bringing everybody to the table. That's the best way to do this, especially on complicated policy issues. Any closing thoughts from either one of you before we wrap up?
I'll just toss in that for me, thinking back on these issues and stitching them together a little bit is oddly energizing. That, I've committed a lot of time, most of my professional career has been working with this association and working with county governments in Maryland. And I feel like this, as a vein of the work that we do, in a lot of ways is MACO at its very best. That our members come to us and say, we need help. We can't do this ourselves, but our residents deserve better service. And we know there's a next step. With 911, we know we need to take that next step, but we can't get there alone. We need your help in making it happen. And while we've extended thanks and gratitude to state leaders, I don't think this stuff happens without MACO as an organization. So it makes me feel good professionally that people who live in Maryland get a better level of service. They're already getting it through next generation 911 across our state. They're in the process of getting smarter and stronger service and healthcare in the field through the way we're treating modern delivery of emergency medical services. Ambulances show up and know they can provide this service and they can do the right thing and get supported for that. Okay, that's a good thing for people who live in Maryland. If we can crack the nut and thread the needle and whatever euphemism you want and find a way to get things on a better path for fire service in Maryland, and we bring along a next generation of people who are committed, who live in the community, who can respond quickly and are ready to do it, that's a better life for us, for our neighbors, for our kids. That's something to be really proud about. I'm not trying to wave myself in the flag and stuff, but I think this is a big deal. This is the best kind of stuff for our organization to be doing with and for our members. This is really good stuff.
For those of you who listen to me when I testify, I feel like this is a Me Too moment. So ditto, me too.
I like it. Brevity is good. So we'll leave it there for today's episode of the Conduit Street Podcast. If you enjoy the podcast, please go ahead and subscribe. That way, all of these episodes will be sent directly to the device of your choice. You can also follow along on social media, Facebook and Twitter. And then, of course, make sure you check out the Conduit Street blog. Ton of content there, including a lot of coverage of the issues that we talked about here today. We'll throw some links in the show notes. But that's it for today. And for Dominic Butchko and Michael Sanderson, this is Kevin Kinnally signing off, and we will talk to you soon.